Well, more than 34 million Americans aged 50 and older could soon be eligible to receive another COVID booster shot.
The Food and Drug Administration said today it has authorized a new round of the Moderna or Pfizer COVID vaccines for those who want them.
The CDC still hasn't made a recommendation, but they may leave it up to individuals. UW Health's Chief Quality Officer, Dr. Jeff Pothof, back from vacation.
Welcome back.
All tan.
Good to see you guys.
Relaxed.
Yeah.
So what's going on here? Should you get the second booster?
Yeah, my recommendation is if you're eligible for it, so you're 50 or older, and it's been 4 months since you've gotten your booster, to go ahead and get that booster. I think two reasons. The personal reason is your likelihood of getting severe disease if you come in contact with COVID goes down. The bigger community reason is if we enjoy not wearing masks and we enjoy going to restaurants and movie theaters without worrying about COVID, all of us being vaccinated and boosted on this schedule prevents the next variant, whether it's the BA2 subvariant or the next one, from really raining on our parade. It provides that protection. So that's the reason I would say if you're eligible for it, go out and get it.
Is our immunity waning?
Yeah, our immunity would wane. This is, pretty typical. Some vaccines we're lucky. We get one dose and we're good for forever. But most, it requires a booster at some point. Our immune system doesn't see the disease. It kind of gets lazy. It goes on spring break like all the rest of us. And then we need these boosters to wake it up and say, well, wait a second. I got to be ready to fight this disease. So not surprising that we see this immunity waning. The durability wanes over time.
So probably a yearly shot, maybe like the flu?
I think that's what we'll get to. Right now, folks are probably saying, hey, I don't want to get a shot every 4 months, and that won't be the future. That's a factor of the pandemic, lots of variants, things happening very quickly. I do think we will get to the state where this will be much like a flu shot once a year. It'll cover the most common variants, and it'll protect us against severe disease, and life will go on like normal.
But for the second booster, it's up to you to get one?
Right now, the CDC will likely kind of give it passive permission, like go ahead and do this. I don't think you'll see as much strength behind the recommendation, not because it's not a good idea, but I think the data behind it is limited. It's based on a few studies from Israel. They typically are a little bit ahead of the rest of the world on boosters and their effectiveness. They are seeing definitely benefit to getting that booster, but until there's more data, I don't think you'll see the CDC pushing it quite as hard.
Okay. The testing site at Alliant was going to close, and now they're going to keep it open until at least June. Who should get tested and when and why?
I think if you're having symptoms of COVID-19, it's a good idea to still get tested. I think we almost have been lulled into the sense that there isn't any COVID out there, and that's not true. Cases are actually just up a little bit. Probably not a big deal, but if you have symptoms, I would get tested. I think the Alliant is nice because everyone's used to that. They know that that's available. It has easy access. It's in and out. So I think it's great that that's open, even though there's lots of additional testing out there nowadays.
And then if you test positive, do you follow the same protocol we've been using from the beginning?
I would say, isolate. You can do that for 5 days. Take that antigen test. Make sure you're not having symptoms. If you're negative there, you can kind of get back into society. I'd wear a mask for the next 5 days. Yeah, I feel like we're kind of getting good at this. We kind of know what to do if we come down with COVID-19.
And I think you're right. I think the feeling out there is this, well, this is over. We're going to concerts, we're going to movies, we're not wearing masks.
All the restrictions are dropped. Yeah, airlines are starting to talk about dropping masks on flights.
But it's still out there.
It's still out there. All these things are okay to do because cases are low, but it would be good to just take that little bit of extra effort, namely around vaccination and boosters, to ensure we can keep living like this, not having to worry about this.
I mean, we live with the flu.
Yeah, we'll live with COVID.
We'll live with COVID.
What's the situation in Europe?
In Europe, there's some diciness there. I think the UK had some increased cases. They saw a few increased hospitalizations. Clearly, with the war in Ukraine, that's an impossible situation to do the things you need to do to prevent transmission. So we're seeing it there. And then likewise, even in parts of Asia, China, Australia. So it's not like the whole world is having the same good luck that we are right now. But hopefully with time, we will get to a worldwide endemic state where there aren't hot spots, and that would be good for all of us.
Isn't Shanghai on lockdown right now?
I believe so.
I believe so, yeah.
26 million people.
It's a lot of people.
It's not over yet. All right, but we're in a much better place than we were.
We're good right now. I feel good about where we are right now.
That's good to hear. Wow, is that good to hear?
Yeah.
Thanks for being with us.
Dr. Pothof. Great to see you.
Good to see you guys too.
Final check of your forecast coming up.